Welcome to the Bioptimizers Awesome Health Podcast. And now here's your host, Wade T. Lightheart.
What if you could double your energy naturally without caffeine or stimulants in just 3 short months? It's not only possible, you can transform every aspect of your health if you follow the 12-week blueprint we've created for you in the Awesome Health System. The Awesome Health System is a free course where you receive a daily video lesson spanning the most cutting-edge secrets for air, water, exercise, sunshine, optimizers, mindset, and education. It's something most companies would charge hundreds of dollars for, yet you get it for free when you go to bioptimizers.com. To access your course, register to download the PDF report called 3 Phases of Bioptimization, which gets you access to the report and daily access to the first lesson in the 12-week, 84-day Awesome Health course.
Good morning, good afternoon, and good evening. It's Wade T. Lightheart from Bioptimizers with another edition of the Awesome Health Podcast. And today we're going to talk about some very interesting topics, things like natural birthing, some of the challenges that we're facing with the medical system, especially around women and fertility issues, what you should do, what you should consider, and how you access informed consent in order to make the right decisions for you and your family to come. And so today we have Dr. Nathan, and we're going to get into all of the components here. Nathan is a medical doctor specializing in OBGYN and hospice medicine. He is also a holistic practitioner with an extensive training, including through the Czech Institute. Actually, that's how we met. We met at a Paul Czech birthday party. Shout out for Paul. And through his holistic OBGYN practice, Beloved Holistics, he provides a means for health coaches and midwives to reliably collaborate with an open-minded, open heart, truly holistic OBGYN that borrows from the allopathic medicine, functional medicine, Chinese medicine, and herbalism and Ayurveda. He also takes clients one-on-one to manage common OBGYN issues like pelvic pain, fertility issues, and abnormal periods. He lives with his wife and children in Louisville, Kentucky. Thank you so much for joining us, Nathan.
Wade, thank you so much for having me. It's great. It's great to see you. Every time we talk, we could go on for hours. So I'll try to keep my responses short here today.
And just a shout out to all our listeners. Dr. Nathan has really been great for myself and my partner. We're looking at having children, and in the current environment, it's a big issue because there is so much confusion, and there are special components that are involved in women's health and fertility issues. And we know overall in industrialized world, fertility rates are dropping for both, and that's part of men and part of women. And you have specific expertise. Can you share with us, because first off, there's a part of that I think people would be interested in, is that you're in birth and hospice medicine. So it's like bringing people onto the planet and giving them the instructions on how they transit off the planet, which is radical in itself. How did you end up in that sort of what seems like a very big polarity in who you're treating?
Yeah, that's a great question, Wade. I haven't answered that one for a while, and like I always tell people, it's a different answer every time. But there's something sacred about being alive, and I know that you and I resonate in that way together. And if you've lost anybody close to you, you realize that, wow, there's this transition that happens, this transformation of spirit. And that thing, getting older, having to face our mortality, is something that we all have to do. And when you if we treat death as a medical process, right, a failure of the modern medical model, then we're not really forced to contemplate what happens from now until then, right? In other words, we're not really forced to face mortality because we have this presumption that somebody's going to save us from this necessary transformation that happens at the end. So my work, even really just working with my dad, who died when I was in medical school from something called multiple myeloma, he was like one of those rough and gruff guys that didn't want to talk about emotions. He really wasn't open to telling people he loved them. I mean, it was that generation of men that just kind of was emotionally unavailable. And I worked with a palliative care group, or he worked with a palliative care group at UPMC in my hometown of Pittsburgh in Pennsylvania. And they got him to open up about things and to really kind of reconcile, like, hey, this is something that's going to happen, and it's not something to be afraid of, right? And so the sort of sacred nature of death started to emerge for me. And then I ended up, in medical school and then into residency, experiencing birth and realizing, like, wow, there's something magical here. And it wasn't until in my ICU rotation when I was in residency where I realized, oh my gosh, like, these people who are dying, right? This is learning how to take care of critically ill people, which sometimes OBGYNs have to do if you have some horrible infection, or they, horrible blood loss, they end up on a ventilator afterwards, and you see the palliative care group go in and face this really challenging thing that nobody really wants to talk about, death and dying. And they walk into the hot oven and they kind of help the family parse through the reality that this is going to come to an end. Well, I then took that and I kind of put it in my backpack and I carried it with me through residency until the very end. And when I decided, hey, the skills, this communication skills around finding out what a person's story is, what their values are, what they really, really love about chocolate ice cream or whatever, that's actually what this is about. And as a doctor, I think too commonly, we're faced with, here is a list of symptoms, fit those into a neat box, and then find the magic drug up on the shelf that's going to fix that problem. Well, there's no fix to death. And we know that. And actually, I would actually argue there's a privilege to dying, and from now until then, that's the one thing we can control. So then, in residency, I'm sitting with birth and I'm realizing there is no medical fix for birth. And as my wife just described, we just had our second baby about 2 months ago at home, which is not something most OBGYNs talk about, but having a baby at home was a really, really important experience. And in my wife, the way she says it is, yes, it's a scary thing. This baby has been gestating inside of me, creating every organ, every tissue with cells from my body. And then when you reach the top of the incline on the roller coaster, you are going to go down the other side. There is no way around it. And that is a scary thing. So as I started really sitting there and with birth, and I've been to so many births and deaths, I don't know, 1,000 of each is what I tell people at least. You realize that there's a spiritual component to this, and that what a person needs from you during these scary things that are sacred rites of passage that can actually be blissful, depending on how you approach it. What they need from you as a doctor is somebody to see them, to witness them, and then to acknowledge that we don't have a way of fixing this. We can't fix your pregnancy or your birth. Your birth is going to unfold whether you like it or not. Your death is going to unfold whether you like it or not. So what I'm trying to illustrate is that there are two sides of the same coin. They are both equally transformative in spirit in the subtle bodies that you and I talk so much about. And if I was to approach every solution with antibiotics, surgery, etc., it degrades the actual experience of the person. And so people love coming to me for their maternity care or their cancer treatment and to support them through the death and dying process, for example, because when they first meet me, I'm not coming to them with a solution without first knowing who they are and trying to understand the underlying metabolic issues or the underlying trauma that they've experienced or the underlying fears that they have about what they're about to go through. And once we sit face to face and we can see each other as human to human, trying to walk one another home, as Ram Dass says, that opens up the possibilities of a blissful experience and a transformation of spirit that is actually embraced as opposed to resisted. So that's how I ended up doing both.
It's such a unique perspective that you have.
Yeah.
And in the Western, I was in a couple of years ago, I was in Varanasi, India. And of course, that's the place. It's like the holy city. It's who knows how old it is. And one of the famous things is the furnaces where they burn the dead bodies right there by the Ganges and throw the ashes into the water. And you're sitting there. I remember we were sitting in this little lassie place, and every couple minutes there's a group of people just trucking her down the street with a dead body. Like you're just presented with a non-stop.
Wow.
It's like a factory of reality in the end of life. And you go to, and I went right down to the GOTS, and the ashes are coming up, and the ovens are on fire. Like, and so this literally mass of death is happening. Something that you'll never see in the Western world. Death has been completely anesthetized. It's put away. It's hushed up. There's, the funeral home business and all this sort of stuff it's all very neat, tidy, and not in your face. And so that I think in the Western world, there's even an exaggerated level of avoidance of this particular topic. And I think the consequences of that is, if you don't contemplate your death, how do you really live?
That's right. That's right.
My question is, as a comparison, we'll get to the birth side of it again, but I want to start with death first, because I think that really sets the tone for birth. In your experience, what would you say was maybe an impactful or positive transformation that you might have experienced one of your clients or patients that really went through it in a really optimal way? I'd love you to, if you could share something like that. I know I've kind of put you on the spot, but I think we need to have a model for like a noble transition. That's something that people are looking forward to. People are not approaching it with the doom and gloom so much that is so common in our social communications.
So let's start with death, and then I have a really profound bad experience with both birth and death in the same hour that I can share.
That'd be great.
Well, so let me start with a good death, right? Because we have to be careful with this, because some people would say, "Doc, I want you to put me on chemo, dialysis, a ventilator, and artificially elevate my blood pressure until the machines just fry out and I go down in a ball of flames. Give me chemo on the way to the morgue." I mean, I've actually had a gentleman tell me that once, and it's because they have this idea that if we fight hard enough, it's that fighter mentality. If I fight hard enough, I can overcome this. My dad had that approach as well. On the other hand, a lot of people, use that language because they're afraid of letting down their families. So there was this one guy recently who, he was in his late 30s, and he had heart failure, cardiomyopathy from basically drugs and alcohol use from like the age of 12 all the way up to the time he died. And he also was gay, and he had HIV, and had his heart was enlarged, something called cardiomyopathy, and it just basically could not function anymore. So he had been seen by cardiologists for years, was put on a medicine called milrinone, which artificially elevates your blood pressure in order to continue to perfuse your vital organs. And he had been passed from one doctor to the next, try this, try that. And they wanted to install something in his heart called an LVAD, a left ventricular assist device. So when I met him, he actually was referred to palliative care, which is not hospice. Hospice is how we restructure your entire insurance payer program so that everything is brought to the home, and your family members, instead of being your nurse and your doctor, they can actually just be family, and there's a nurse and doctor that come in to do that work. So he was contemplating palliative care and how can you make my life better? And he was short of breath because his heart doesn't pump. And when your heart doesn't pump, fluid backs up into your lungs, and it just makes it extremely hard to live. But he was on this medicine that was keeping him alive. And the medicine carried this big giant battery pack in a big fanny pack. And his family him and his mom were on the call together. And at some point I kind of picked up, like, I don't think he's being square with me. So I asked him if we could talk in private, and I asked his mom, "Hey, can I call you back after this? And I just want to talk to your son." And as I did that, I realized this guy's tired, and nobody's acknowledging how tired he is. And I said, "What's it like to be you?" And he said, "I'm exhausted, Doc. I've got this battery thing I've got to haul around. I've got this oxygen tank I got to haul around. I can barely get up my steps without having to stop and cough up a bunch of sputum. And like, I just feel like hell." And I said, "Well, when these doctors are talking about these surgeries and placing these devices and whatnot, which basically is like a pool pump, you listen to their heart and they have no lub-dub. They have a circulating blood. It's a really creepy device, and people always feel like hell after they have an LVAD placed." And he said, "You know what, man? I'm just tired. Like, do I have to keep taking this medicine? And that, because I asked and I stopped and I saw him as a man speaking to a man, we were the same age, actually. I gave him the opportunity to express it. Like, I don't want to live like this anymore. What are my other options? And then we actually started talking about hospice. And so got him into hospice. I called his mom. We talked about all this stuff. He was worried his mom was going to be disappointed, with him. He's an Irish Catholic. He was afraid his mom was thinking he gave up or something like that. And his mom was like, oh my God, I never knew this. And this was like 5 years of this whole journey for them. And so we got him into our inpatient hospice unit to turn his medicine off. So we had everything right there, just in case he fizzled out in a matter of hours. And I went in to see him in the inpatient unit. It's basically a hospital bed, but it's a little bit more cozy. There's a bed for family to stay and a shower in the room. And it's different. It's more relaxed. And we shut the medicine off and he was still with it. And I went in and he gave me a fist bump. I put my stethoscope on his heart. And I was like, man, your heart's still going. Like, it sounds tired, but your heart's still going. And he was like, that's good, because I got people coming to see me. And this flood of people. His mom was there every moment until he passed away in a couple of days. But this flood of people, like his whole life story played. It was kind of like Big Fish. Remember that movie where it's like this guy he met when he was 17, and this guy who used to employ him at the ice cream shop, and this guy here who, whatever, this gentleman lent him his car when he was desperate, or lent him all of his money, and like he had done all these good deeds, and his mom had no idea about this history. And so this guy got to see one visitor after another, and he slowly got weaker and slowly got more short of breath and slowly went comatose, and he passed away. And I spent so many hours talking to the family, and his mom was desperate to hold on to him. But I talked to her. I said, I think some people, when they're passing away, they need our permission to tether that cord. Like, he's only going to have one mom, and he's your only boy. And I know that this is really hard, but I bet if you walk out of the room at some point and you let him just rest, I bet that will allow him, give him the permission to tether that cord. And, when you're dying, you're actively dying. It's you've got 1 foot in the astral, 1 foot here in the earth school. And sometimes it does take some courage, and it takes some space holding for that to happen. And he passed away. They even named me in his obituary. And I was so flattered by it, because like when you go to medical school, you never think that, that your best work will be done by taking medicines away. But in the sort of adage of do no harm, it would have been more harmful. In many people, it's more harmful to squeeze every last ounce of juice from that lemon, as opposed to just acknowledging that this is going to happen. And because we saw him as a person, he was able to feel into that space and really lean into the inevitability, which is that we're all going to die. So that's one story that I was like, wow, if there's a good death, that sure as heck sounds like a good death. But I do caution people to say good death, because it's different for everybody. And that's part of the beauty of what I get to do in my end of life work.
Yeah, it reminds me, just recently I had a friend. He was 80, robust guy. He had battled cancer, overcame it, despite what the doctors expected. He got to another place, and then it came back a few years later. And he gave me a phone call. He calls me up one day. He says, hey, the doctors told me I've got this, the cancer's back. It's run. It's altering me, and they can extend my life a little bit. He said, I'm taking some meds that they said will give me a little bit longer time. He goes, because I'm going to have a birthday party. It's my 80th birthday coming up. I'm inviting all my friends. Might be the last time you get to see me. This is the way it goes. I'd love for you to come by. And I went there, and a whole bunch of people came to the birthday party. We had a great time. And after the birthday party, his decline was very, very quick. And I did get to go see him one more time just before that, like literally just before he died. And it was interesting, the shift from that moment, which wasn't that time, to the end. And why I want to say that is because he had gotten permission from his family, from his friends, and had gone out and said, it's the way it goes. Here we go. And he faced it like a real warrior. And I really appreciate it, because it was like, that's a great way to make that transition, And so let's go to the other side of it. Let's go to the
sure.
Right.
So this one's not as uplifting of a story, but it was pivotal for me in standing in my truth as to how I wanted to show up as a healer.
Mm-hmm.
And healing comes in so many colors, as you know. I mean, as we live, we find healing, throughout our lives, we find healing in the most unusual places sometimes. And, we talk about diet and movement and hydration, sleep, mindset, all of Paul Chek's principles. And we all practice those. That's what we do. It's a lifestyle. And we have the resources to do so. But healing also comes in other forms. And especially with something like cancer, like for your friend, if you go to an oncologist, they're going to say you have to treat with chemo. Well, what if chemo is going to prolong your life, but make your life miserable from now until then?
Mm-hmm.
It's not as easy then, right? Which is why when I first meet somebody, in the first hour that we meet, we're not even talking about cancer. We got to talk about what your values are and what's important. And so let's jump into the birth world, which does teeter then into the death space. When I was in resident, I was the 4th year resident. That's the chief residency. I was my chief resident. And this woman came in, she had a pre-prom, which is when the waters open up way before term. And that's not necessarily a good thing, but it's not necessarily the end of the world. Usually it's not like a baby's just falling out. It's a woman comes in, there's leakage. We test it, crap, the water's opened. A little too soon. So we load you up with steroids for the baby's lungs to mature a little faster. We get the pediatricians on board. And this lady was like 32, 33 weeks. So it wasn't the end of the world. We had seen worse, like 28 weeks is a pretty bad time to have the waters open, but 33, 30, 34, whatever. And then when the baby came, a couple of days later, the baby came and the baby's, preterm. So the pediatricians and the NICU staff are there to make sure the baby transitions well. And this baby wasn't transitioning well. So they called in extra staff. They called in the attending physician, the NICU attending, which is a pretty big deal. You don't usually call them. Because you've got your respiratory therapists and all these other people that can put tubes in and lines in and all that stuff right there on the spot. They could not get this baby breathing. And the baby was blue. So they rushed to the operating room down the hall and the mom and dad are like, what the hell's going on here? And fast forward in the operating room, they'd called up the pediatric surgeons. They called up some other anesthesiologists. They called up the ears, nose, throat doc, the surgeon, and they cut into this baby's airway. And they found that there was a gap in the trachea about 4 centimeters. And so the high-risk OB is there, the chief is there, me. They got all these other surgeons and we're looking at each other like, we can't fix this. So what do? Right? If everything looks like a nail and you've only, if you only got a hammer, everything looks like a nail, but what if there's no more nails,
Mm-hmm.
So the mom is in there, the dad is in there. We tell the family, like, we can't fix this one. So this baby's going to die. And at the time, the main stem bronchi, they branch, and then you get these airways that branch into bronchioles into the lungs. You can cut a little hole there. We did, not we, but they did. They put a bag there, like you see in the ER, to breathe, to push oxygen into the lungs, which was sustaining the baby. But there's no long-term fix. We can only do this for so long. And so, and it's not even like a time where you can talk about, let's just put an intubation tube in and then ventilate forever. Like, this is going nowhere.
Mm-hmm.
And we all knew it, but nobody really wanted to say it. So finally, we told the family that we can't fix this. And they say, okay, there's a pause there as we're bagging this baby. And they said, well, we want to hold her. And they did. And they wrapped this poor little baby up, preterm baby up in a blanket. She's holding this baby. And they take the bag away. So we know this baby's got very limited time, probably a matter of moments, minutes. And there was all this commotion in the room. And I was sitting there holding space. I was going to hospice and palliative care fellowship. So death was something I was super thoughtful about. And I had also started to already embrace the sacred nature of birth, where like, wow, the more that I muck with birth, the worse things happen. So let's just let birth unfold, hold space for birth. So I was holding space for them, practicing what I now practice at end of life and in birth. And in this moment, this baby was born moments ago, and this baby is finally taking its last breaths after just being alive for less than an hour. And the surgical tech is rearranging instruments, and nurses are going in and out, bringing papers and going out and getting this and that. And everybody's kind of chatting, and they're adjusting the blood pressure cuff on mom and adjusting the blankets. And, it's all this commotion until finally, can I curse on your podcast?
We'll avoid
Okay.
where it's PG.
Okay. I won't curse. I won't use the expletive, but she says, can you guys just leave us alone? You can fill in the blank there.
Right.
And she said it, she was falling apart, and so was her partner, this baby's dad. And all that they wanted to do was be there and be present with their little girl, who they're never going to see grow up. This baby came in and went out faster than that.
Wow.
And so you could hear a pin drop at that point, and everybody left. I just kind of asked everybody to leave. And it's not like it's my job or anything. I would get in trouble all the time by asking people to leave because they're not necessarily important for the moment. But in this case, everybody got it. Everybody kind of filed out, and it was me and one of the nurses, and we just sat there and we watched this baby die. So there's not really a moral of the story here, but this is in and of itself an opportunity for us to gain some healing about what it means to be mortal and conscious human beings. And how we show up to life and how we show up to birth and to death really matters, Wade. So in this case, I did have the opportunity to be at a birth and a death and attend both on the same hour, the same shift.
Wow. And
it really, it's the first time I've told that story in an interview or otherwise without tearing up, because I've got two little girls of my own, as you know. And it was a very, very, very impactful time for everybody involved. And what a lesson, if you don't have to have the answers. You don't have to be Mr. Fix-It or Mrs. Fix-It. You can just hold space and then go home and love your wife and love your kids.
Yeah, it's powerful. Two things it brings up for me. I got exposed to all of that kind of stuff with my sister's illness over 4 years and her subsequent death.
Yeah.
She was only 22, and I was, I think, 15 when she started that whole journey.
Right.
And that was the thing that I learned in that process. I learned that we would have conversations about death as a teenager and what she felt about it and how she was. And everything that you've echoed here were things that she was able to observe. And a lot of people think that the person dying might not be aware of it. Or one might add, I think we underestimate the level of awareness that a baby might have about these things as well.
Bingo.
And so it's not what people think, and there's a beauty in it if you can find even in the most traumatic situations. And years later, I came into the writings and lectures of Dr. David Hawkins, who was a profound psychiatrist and medical doctor, and really was influential in orthomolecular nutrition. He wrote his first book was Power versus Force, and a subsequent series. And amazing books, transformational. And I used to take groups of people to go see him in Sedona every year for his lectures, which were just awesome. You can check him out on YouTube. And he's laughing about a lot of the most macabre things in the human existence. He would laugh, and it wasn't that he wasn't non-empathetic for it, but he was extremely empathetic, but could find the kernels inside of it. And he wrote a book called Healing and Recovery. And he separated the difference between the two, because running the largest psychiatric practice in the world, he was dealt with the most extreme cases of psychiatric illness. So think of the most, dysfunctional, mentally challenged person you've ever dealt with in your entire life. That was just the start of where he was dealing with his medical hospital. And he said he felt like he was trying to bail out the whole ocean with a thimble. And he came to this conclusion that healing and recovery were different. And he found it in his practice. And that was, healing was the recognition that the soul of that individual was seen and had value in its essence. And he said he would, he said, whether sometimes the patient would recover in the eyes of the world, they would recover from their condition and move on, and sometimes they wouldn't. But what he began to learn as a physician, that his job was to facilitate healing of the inner being inside the physicality, and the recovery was up to God. And I thought that was a very profound, insightful. And in his book, he goes into all the different components of it and things like that. It's a beautiful book for anybody in the healing practices. Yeah. But I just wanted to add that in for people who are interested in that to explore. But I want to go to the next piece, which we touched on just before we get on here, which essentially what you're doing in both of those situations is something that I think is really important to people today under the current conditions we live. And that is a medical doctor's primary job is to provide informed consent for the patient. Can you share with me specifically what informed consent is, what a medical doctor does for the patient, what you're trained to do, and then maybe you might even touch into some of the things that are happening now, which we're seeing uninformed consent that's happening from our federal agencies.
So here's a classic example. Before I give you my definition, here's a classic example. Baby's on the monitor, woman's in labor in the hospital, and this is in my world. I am an OBGYN. You walk in and you say, oh my gosh, the monitors show that the baby's having some distress. I think we should go to a C-section. And the woman says, I don't know. I don't feel comfortable with that. But can we have 5 minutes to think about it? You go back in and use a little more forceful language this time. You say, if you don't get the C-section, your baby's going to die. You don't want that, right? And now they're kind of stuck in this funny problem, right? If they say, no, I don't want my baby to die, it means that they're essentially agreeing with the doctor, right? Without having more information. If they say, yes, I want my baby to die, then they sound like a psychopath, right? Mm-hmm. So let's park that. So the way that a doctor has counseled you towards C-section is not inclusive of risks, benefits, and alternatives, right? You don't have enough information to make an informed decision. So here's a doctor's role. We are highly skilled, highly trained, very smart, very educated. But if we can't communicate it, then we are coercing a person to do what we think is right. So a doctor's job, or any healer, or any person in healthcare, whether you're a midwife, a nurse, doctor, whatever, your job is to provide risks, benefits, alternatives using non-coercive language to any intervention, whether it's a pill, surgery, chemo, radiation, whatever. And then your job is to support your patient's decision. Now, that might mean, you know what? I realize that you want this thing, but I don't do that thing. Since you are making an informed decision, you have the capacity for decision making, meaning you are not, this is not a part of some manic episode, or you're not extraordinarily depressed or in horrible pain when you're making the decision, or that you're not cognitively intact. You've got Alzheimer's, you have some sort of chromosomal issue like Down syndrome, and you maybe don't understand the risks, benefits, etc. Once you've said, this is what I want to do, I don't have to do that. I don't have to do a surgery just because you asked for it. But then I need to actually facilitate you finding another practitioner that might be comfortable with exercising that thing that you've requested. So the reason this is relevant right now is because what we are seeing within the COVID space is that doctors, medical scientists, researchers, et cetera, are being deplatformed, meaning they're having their livelihoods in many ways taken away. Their LinkedIn profiles are coming down. Their Twitter accounts are getting suspended, what have you. They're losing their licenses in some places because they are providing risks, benefits, and alternatives to a vaccine that is not FDA approved, by the way, everybody. If you're going to punish a physician for providing the information that is required for a patient to make informed consent, if you're going to threaten them with, losing their license, et cetera, you are compromising a primary principle in bioethics, which is patient autonomy. And people don't understand why this is important. We are compromising a principle of bioethics if we are telling a doctor, you can't give the risks of a device, a surgery, a pill, because it will make them hesitant to take that. That is an egregious violation of patient autonomy. So in my world, people like coming into my practice because I will also make, our job again is to also make recommendations. You can say, here's risks, benefits, alternatives. And you might say, if it was me, I'd probably do this thing. Or if it was me, I wouldn't do that. And that's okay. That's more information. They're like, thank you, doc, for telling me what you would like. I still want to hold off on getting chemo. I appreciate that though. I'm going to go for mistletoe therapy, or I'm going to try vaginal steaming for my cervical dysplasia, or whatever else. That's fine. That's totally fine. But what's happening, what has been happening within the birth world for years is the use of coercive language without doctors even realizing that they're doing it, I have to say, because we're trained to do it from day one. We're trained to use language in a very deceptive way in order to get patients to agree with the intervention, whether it's a C-section, birth control, whatever else, that we would recommend to our family. And that's not informed decision-making. So what I engage people in is called shared decision-making, right? Which in birth, you might even say, I don't have a part in the decision. So shared decision-making might not even be completely clear, but there's a great physician in Atlanta, Georgia, who recently had his privileges suspended for no reason. He was the former head of the OBGYN department and whatnot. His name's Brad Boots Taylor. He wrote a whole book on shared decision-making as practiced by OBGYNs because we're never taught this stuff. So a lot of doctors think this is, cockamamie, but it's because for them, fish doesn't see water, right? And for me, going into birth with my own wife and seeing so many of my friends go through and feeling violated, like they don't feel like they actually got to make the decision about what happened to their bodies. They just felt like they were kind of caught in the current of the conventional medical model, and they find themselves in the operating room not realizing how they even got there. And then they look back and they're like, God, that didn't feel right. It's traumatizing to people. And I don't think a lot of doctors realize that. I think I've said enough. I'll pause there for a second.
Well, this is a really, really key. And, I was reviewing this recently with my parents. And so my parents, I'll preempt this. They're happy to do this. So my parents live in Canada. The Canadian government puts forth some very hard government directives with zero exceptions in regard to some of like zero exceptions, even if they are medically legitimate. And in the case of my dad, he had some specific, and he doesn't mind me talking about this, he had some specific heart issues and stuff that I had conditioned because we have genetic conditions inside our family. And I had requested, I said, listen, why don't you go to your medical care practitioner, go to your doctor and ask them specifically these things, risk, benefits, alternatives.
Right.
And the doctor wouldn't provide that information to him. And I'm not faulting the doctor because I understand the doctor's got medical bill. They got they're working in a small practice in a very small town. They're under government directives. They have a certain, probably a bunch of student loans that is associated with. They've been in school for 15 years. They're just starting to get their traction in life. And now they're under this tremendous pressure that could risk their career for providing risks, benefits, and alternatives. And it's easier just to go along. And I understand that. And I think for all of us out there that are condemning our medical practitioners who are under fire for this, we also need to approach them with empathy because they're in a very difficult position as well. And that we now they have to keep cognizant of what they are doing. They have to navigate their local medical sphere, their peers, whatever the directives are coming down from a government, their own financial and family situation. And they're making decisions based on that as well. Right. And not everybody has the same ethical nature or can sustain the consequences of moving to a supreme level of ethics over and above to provide that. Yeah. And it's difficult. And the good news is we were able to get some help, and you were very helpful to provide my family with exactly that: risks, benefits, and alternatives. And so part of the reason I wanted to have you on today is to share with people what a doctor's job is, because a lot of people don't know. They just go and the doctor sees them for 5 minutes and writes out a couple prescriptions and you're out the door. They don't know what the prescription's for. They don't know what the risks are involved. They don't know why they're doing it. They don't know if they can get off it. They don't know if there's any other angles. They're just like, well, my doctor's, the most common thing is my doctor said so. And I said, well, what I always would question people, and I learned about this in the personal training world. I would get all kinds of people with medical conditions, and I would say, I don't know what that medical condition is. Can you tell me these same things? What are the risks and benefits of going into athletic activity? If there are dietary things that we can do as an alternative component, right? And oftentimes the people ended up switching doctors when we started asking those questions. How would you suggest being a doctor, how best can a patient speak to a doctor? I think that's the other part, is we don't have the schooling of how well that we can respect your authority, but ask the questions that we might be conditioned not to ask, to alleviate some of those things that we face either in birth or in death.
And now for a Bioptimizers fixed digestion tip: supercharge your protein shake. Everyone knows protein shakes are a great way to sneak in extra protein, build more muscle, even replace meals and burn more fat. The problem is the highest quality protein typically absorbs at around 40%. One way to fix this and dramatically increase how quickly and effective your protein shake digests is to add 2 to 3 capsules of masszymes into your shake. One research study showed that pre-digested protein during a meal increased muscle growth significantly. To take advantage of this, just blend the open capsules into your shake, and within 15 minutes or less, the enzymes will have begun to break down the protein into amino acids. This can make your shakes at least 2 to 3 times more potent. Some people do this and sip on their shake while lifting to provide their muscles with a steady stream of amino acids during their workout. To save 10% on masszymes, use the code SHAKE10, that's SHAKE10, at masszymes.com. That's SHAKE10 at masszymes.com.
Man, Wade, that is $1 million question. Like I said, I don't think doctors even realize how egregious these errors are, right? And how actually it's not just bad practice. It's also the reason why there's growing distrust among the public of the medical system. Mm-hmm. Because, like, let's say that one person reached out to me when I was on Twitter back in the day, and they were really miffed about something I'd said on my previous podcast. And I'd said something about birth control, and I was like, there are risks to these things. Like, we pass out birth control pills to everything, to women, for everything under the sun, from contraception to abnormal periods to painful periods to, it's the list goes on. I mean, we use them all the time, and we don't really present the full spectrum of risks that come with that. Not least of which is that it messes with your microbiome, and if you mess with your microbiome, you mess with your immune system. If you mess with your immune system, you mess with your cancer risk and your autoimmune risk, and everything that comes in, everything in between, everything people are taking masszymes for and whatnot, and birth control pills are just the start of the tip of the iceberg. But this person was upset because I am against birth control pills because I was presenting some data on, hey, there's some data here that suggests that birth control pills might affect the gut microbiome. And maybe that's why so many people end up with mood disorders when they're on, birth control pills. And we're talking about combined oral contraceptives, right? So that it contains estrogen and synthetic progesterone. And that exchange stuck with me because it's the same thing that's happening with these vaccines. Just because I'm presenting the perhaps downsides of birth control does not mean that I'm against birth control. And I happen to actually be pretty, at this point, pretty adamant that we try some other things before we do a birth control pill. But I'm not against birth control. I just see that as a technology that has a lot of downsides, a lot of risks, and only a few benefits for some patients. So, so back to your question, I think that doctors are so unclear as to what that really means, this real informed consent really looks like, that you as the consumer need to start rewarding doctors that are doing well and not punishing, but just choosing not to go to doctors who are not doing that well. If they're not willing to exchange with you in the 7 minutes you get with them when you waited 3 months for your appointment on risks, benefits, alternatives, and then making a recommendation themselves and then supporting your decision, then unfortunately they need hammered in bioethics, those principles that we talked about. So what I would say is keep in mind that, yes, you're right. There's a lot of pressures on doctors to do certain things. Big Pharma is way too deep into the pockets of medical systems and the clinics that are serving you. But we are consumers. We can vote with our dollars. And if you go into the office and you respectfully ask them about risks, benefits, alternatives, why do some people like this? Why do some people not like this? That language should prompt a conversation. And if it's not, then find yourself a different doctor. And that's the way it goes. Nowadays with COVID, telehealth medicine is like huge. You could find a doctor I don't mean to shamelessly plug my practice, but that's how most people find me, is they're like, my doctor told me I need to be on birth control for the rest of my life. Like, I don't want to. It makes I've got no libido. My husband, my hair's falling out. My skin's changing. My mood's all over the place. Like, I don't want to be on birth control, And so we talk about using diet and exercise and vaginal steaming and all these other things. So I know I'm not really answering your question, but I don't really think that there is an easy answer until doctors start realizing that they're losing business because they're not giving people the full spectrum, the full scope of risks, benefits, alternatives, and perhaps even thinking outside the box a little bit.
Well, I think if we start with that question in a respectful way, it's like, hey, doctor, I'm a layman.
Yeah.
What are the risks of what you're suggesting? What are the benefits?
Yeah.
Is there any alternatives?
Yeah.
How do you see this? Because oftentimes, in the rush and the pressure that doctors on, they don't get into all of those conversations, and the person goes down that journey for a year or two, and they're like, oh, well, now you need this other medication, or now you've got this, or you've got the consequences of that. Even if that was the best choice of that time, you weren't making an informed consent because you didn't ask the questions. Right. And one of the things that I'm encouraging everyone who listens to this podcast, ask questions. It's okay not to know. Now, that means you don't have to be disrespectful in asking those questions. And if someone, like, I'll give you a great example of a tell. I was watching recently the hearings on in the government where Dr. Fauci was being questioned aggressively by another doctor, Dr. Rand Paul.
I saw that testimony, yeah.
And what was interesting is that Dr. Fauci has decided that he represents science. And science is not static. Science is supposed to be questioned and challenged. And the exchange is Dr. Fauci had been challenged by other extremely qualified people, and some would argue in the world of virology and epidemiology that they were maybe even more qualified from him, and he engaged with Dr. Collins in order to do a smear campaign in public magazines against this. And this is the issue, and whether you're on the Dr. Fauci side or you're not on the Fauci side, what we're sharing what I want to illustrate here is there are forces that are influencing the decisions both on a political level and inside of your medical level that your doctor is subject to. And as a citizen, as someone who is under the care of that doctor, you have to ask questions for your own right to your own health. And if you don't ask questions, then you bear the consequences. Ignorance, the consequence of ignorance is death. Right. Wages of sin is death is a religious term. Now, sin means to err. That's the etymology. It's actually referred to archery. When you didn't quite hit the bullseye, it was considered you were sin. You had sinned and you were trying to close in on the mark. And so in today's world of massive information, I think it's important to do that. I want to switch to one more area before we go that aside.
Wait, can I add one more thing to your list of questions? Whenever
yes.
When patients, you've heard both of us say now, ask about the risks, ask about the benefits, ask about alternatives. What doctors often do is they will glean over the risks and they'll emphasize the benefits if it's what they personally think is the best option. So one way to kind of slice through that is ask about NNT, number needed to treat. So an example here is, and you can go online and there's the NNT group. It's a nonprofit that actually publishes just the NNT for different interventions. This is quite an interesting sort of collaborative effort here, but take the HPV vaccine. We find HPV is prevalent or is present in most people who develop cervical cancer. Doesn't mean if you have HPV, you're going to develop cervical cancer. But the thought behind the HPV vaccine was if we could get adolescent girls before they start having intercourse and passing around this virion, this human papillomavirus, we vaccinate against them. They build antibodies. They can fight off the virus so that it doesn't cause precancerous lesions in their cervix specifically, but also the vagina and the vulva. So a question that you as a mom, let's say your daughter's 9 or 10 and you're considering getting her this vaccine because you don't want her to get cervical cancer. A question for your OBGYN or your family doc who's going to be administering this vaccine is how many young girls need to be treated with the vaccine to prevent one how would you say any pre-cervical cancer, right? And the number happens to be 60. So again, it's my job to give you information. So if you as the parent and your child now know that for every 60 young women who is vaccinated with the HPV vaccine and receives the full course, which is 3 doses, unless you're less than 15, and then you can get away with 2 doses. If 60 young girls are vaccinated, one of them will dodge the bullet of getting cervical cancer. That doesn't mean it's the right or wrong thing to do. But now you as the consumer can make an informed decision. So I just want to emphasize, like, there are little statistical principles like this. And if people want more information on this, they can always reach out to me. This is what I do all day long, is counsel. And then if that's what you want to do, fine. I'm not going to coerce you into not getting it either. I feel like that's the other side of the coin, is we just use language inappropriately. So I just wanted to end that segment with that.
That's great. And the website for those who are looking is www.belovedholistics.com. We'll put all the show notes in here. Switching gears, just one last thing. I know we've got a limited amount of time to address this, but let's talk about something that's happening en masse in civilizations. We touched on it earlier, and that is people who are struggling to be pregnant. And I know that you work with a lot of people in this specific area. Can you share with us maybe briefly the reasons from a male-female perspective, and then what would be how they would engage in hiring someone like yourself to assist in getting pregnant?
Yeah, absolutely. Yeah. I mean, this is kind of one of my specialties because, again, I'm really not a big fan of birth control. Part of the reasons is women are in birth control for, let's say they get on at age 14 because their periods are crampy and they're heavy and they're unpredictable, and they are embarrassed because they bleed at school and they don't have a tampon or a pad with them. And so the doctor says, hey, easy, let's get rid of your period. You go on birth control, and for the next 20 years, you're on birth control until age 35. Now you want to have babies and your reproductive system's not working. Could be partly because of the birth control pill itself. You are taking hormones, putting your ovaries in a state of sleep for all those years. It could also be that originally your abnormal menstrual problems were related to an upstream issue: hypothalamic, pituitary, thyroid, adrenal, the list goes on. And so because the reason for your abnormal periods was never investigated, now you're struggling with getting pregnant and you're off the pill. We're taught when we're young kids that if your penis approaches a woman, that they're going to magically get pregnant. And it doesn't really work out like that. So park that for a second. Keep in mind, 40 to 50% of all infertility issues are related to the male, right? We used to have about 150 million sperm per ejaculate. Now it's something like 30. So we've got 1/5 the number of swimmers in there. And that's just count. That doesn't even mean that they all are morphologically healthy. So the first thing that when a couple comes to see me, that I have them do is I have the male start to eat 3 times a week a box of oysters. And the reason is it's rich in selenium, it's rich in zinc, it's rich in vitamin D, vitamin A, manganese, all of these micronutrients. The reasons oysters and similar shellfish are considered aphrodisiacs is because it gets the juices going. It really does. So get a semen analysis for the man. Even if it's perfect based on their parameters, the oysters are going to help you get pregnant. So that's the first thing. The second thing for the men, stop using the sauna every single day. There are Finnish studies in some other Scandinavian countries that show that men that are in hot saunas, we're talking like, I don't know what it is in Celsius, but 200 plus is pretty hot in Fahrenheit. So if you're sitting in a hot sauna every day for 30 minutes, which is, pretty challenging anyways, but a lot of people do this now as a routine practice. And I love sauna, don't get me wrong, But if you're cycling, if you're wearing tight underwear and you're sauning all the time, there's a good chance that you're going to have some morphological issues on semen analysis. So we want to maximize sperm count, maximize how efficiently those little flagella are moving on the sperm. And then we also have to turn to the female side, right? And one thing we don't teach women about is fertility awareness. They don't know when they're ovulating. They don't know when they're about to menstruate, because many people are on birth control, and you don't ovulate when you're taking combined oral contraception. So something I often say is that women are gifted with a fifth vital sign. It's actually the name of a good book by Lisa Hendricks and Jack. It's called The Fifth Vital Sign. It teaches you all about the menstrual cycle, which includes menstruation, which is separate from ovulation. Ovulation is when the egg is released. 10 to 14 days later, give or take, you're going to have menstruation because the egg hasn't met sperm. There's a drop in progesterone, and bam, you get a flood of blood and tissue from the uterus out. And then the cycle starts anew in hopes of getting pregnant next time around. Keep in mind that even for a young, healthy person, the chance of you getting pregnant on any given cycle, even with healthy sperm and a normal, healthy reproductive system in the woman, it's about 20%. So you're not like, again, it's not like you walk, you breathe inappropriately near your wife, and suddenly now that you're not on birth control, you're going to get pregnant. So what I generally will start with is I start to teach women about how to determine when are they going to ovulate. And certain things happen. Most people know about basal body temperature. It goes up a little bit. Most people know about changes in the cervical mucus, changes in the cervical position, but they haven't been monitoring it and charting it for years. So what I always tell people is, if I can teach you about how your cycle works, you're never going to need me again. Like, I don't want to see you again. I want you to go get pregnant and go and have fun having a baby. I mean, of course they come back and then we have a baby together too. But when you teach a person, you empower them with the information about how to determine when their body is ready to have a baby. Then we can time intercourse and we can just make it happen. And it happens 90% of the time, 99% of the time, really, when it's done effectively. So the things women should be looking for are a bump in their basal temperature, change in cervical position, and then a change in the cervical mucus. It starts to look almost like egg yolky. And that's because the egg yolky consistency of cervical mucus facilitates the journey of sperm from the vagina, which is relatively inhospitable to sperm. It's acidic. They travel up through the cervix and into the uterus when the cervical mucus is just the right consistency. So, my wife and I got pregnant when she was like, yeah, it's time, and I had been trying to do this without fertility awareness because I never learned this in school, believe it or not. We don't even teach this in residency, let alone to young girls in middle school, right?
Wow.
So I just thought you hijack your hormones and then you force the body to get pregnant, right? So if we can get all the fertility and awareness stuff down, chances of you and your partner getting pregnant is pretty darn good. But let's say it's not. Let's say that your cycles are all over the place. That's when we get into the work that you do. We try to rebalance the microbiome. We try to rebalance their immune system. Women who have endometriosis, that is probably an autoimmune condition. It's not described like that by OBGYNs, but I'm almost certain that it is. And the reason is because they are inflamed. You can see it. Like, they are just in pain. They're inflamed. It's cyclical. It's hard. So that generally in our country, at least in the Western world, I should say, is related to an underlying issue in your gut. 70 to 80% of your gut, your immune system lies in the gut, and your good and bad bacteria are all out of whack. And part of it is that many of us are born by C-section. Many of us are not breastfed. Many of us are being loaded up with vaccines and antibiotics our whole lives, so that our gut and our immune system is totally out of whack, which is why in rich nations, generally white people of privilege are the ones who suffer from autoimmune conditions. Like, it should be ringing bells for people. So we do all of the stuff that you and I talk about, that Paul Chek and his institute teaches: the sleep, movement, mindset, hydration, breathing, and food. And again, for the small portion of people that can't get pregnant using fertility awareness, we go back, we do that. We do some liver detox. We start supplementing with some key nutrients, namely fish oil. I get my fish oil from Green Pasture fermented cod liver oil, and then organ meats. I make them myself. I get them from a biodynamic farm. I like getting people on probiotics. P3OM is one thing I recommend to a lot of clients, and we have to work, from the foundation. If you can lay down healthy soil, then the soul of that baby is going to see this as a healthy place in order to emerge into the earth school 10 months later, 9 months later.
It's super great. Let's talk one last piece, because we got a few more minutes, and that is once a person is pregnant, how does your practice, or how do you address that kind of journey and till the baby's born and all that sort of stuff? What's that like for people? Because it's not like hey, I'm one and a done. There's things that you can do to make things better, I would assume. Can you share a little bit about that?
Yeah, I have actually a pretty unconventional practice, as you can imagine. I'm not a huge fan even of prenatal vitamins, because a lot of them are processed with a bunch of other junk. So again, back to the organ meats. I had my wife taking 2 liver capsules a day, and we alternated between 2 liver and 2 heart, beef heart, beef liver, beef heart, beef liver. And then we were using higher dose fish oil. And the reason I recommend those things is that you get all these micronutrients and these fat soluble vitamins, A, D, E, K2, and you just load the body up. I mean, and organ meat is filled with a whole bunch of other micronutrients. So with that and some other supplements like your magnesium breakthrough, I know I'm shamelessly plugging your products, because once I found magnesium breakthrough, I was like, awesome. Like, I don't need to worry about the magnesium part again. But magnesium is another great thing. A lot of women get a lot of muscle cramping, and they get really uncomfortable because your body's under the influence of high levels of progesterone and relaxin, both of which make the connective tissue between every joint in your spine to your hips, to your knees, to your ankles. Everything's way more flexible, which I'll talk about exercise in a second. But given that, your musculoskeletal system is just relearning every month of the process. And as you're, the reason we have those hormones circulating is that when the baby's coming out, your pelvis actually opens, it separates, all that connective tissue gets gushy, and it becomes flexible and allows the baby to come out. And then it sort of involutes back to its original position and into the postpartum period as you kind of learn to walk again, right? Your body, your center of gravity, everything changes. So there's important reasons to have this, but it also causes a lot of muscle fatigue and muscle aches and everything else. So that's what I recommend from a supplement standpoint. Everything throughout the pregnancy, including every ultrasound, every dietary whatever, there's going to be risks, benefits, alternatives. I don't ever recommend anything to somebody unless I think it's absolutely necessary, because the body really does know how to do this, all the way up through the birth of the baby itself, all the monitoring, all the ultrasounds, all of the interventions that people say it's safe. Well, safe compared to what, right? The body knows how to do this. Let's let this process happen. And if I need my allopathic tools, even in the birth of the baby or in helping the mom recover afterwards, I don't reach for those tools unless it's absolutely necessary. And I could go on and on and on about that.
That's I think beautifully and well said. So before we go, I want to just talk about, I know that you make your services available for telemedicine, packages where you can coach people through both the birthing side and things, or maybe they have questions around what they might be, how to get informed consent about vaccines, or if that's right for them, or if they want to have pregnancy or for their kids and stuff. So you're available. Can you talk about a little bit about what you do, your podcast, what that's about? And the kind of packages you offer for people, because I think there's a lot of my students and colleagues and friends who listen to the podcast that would like to know more. And I can testify, just before we go into that, for those who are listening, both myself, many of my friends have used Dr. Nathan. My mom and my dad, who
lovely people,
they just felt so good after talking to you on the computer. They went from, oh, I don't know, to like, I'm scared, and how do we get on the phone, to like, wow, that was amazing. And I think just to share with you that impact for people, when you move people from disempowered, confused, I don't know, into one quick phone call with you over the hour, and their lives are transformed and they move into a position of empowerment and feeling good. To me, that is healing in itself. You're relieving some of the anxieties that we have, the confusion, the distorted information that's out there. And I want to thank you for that service. It's made a big impact in my life and my friends. So thank you for that. Please share without any holdback what Beloved Holistics is all about, your podcast, and the packages you offer for people who are walking down that pathway. Yeah, well, I appreciate you so much, Wade. And I really wanted to also acknowledge just what you're doing in the world. And when I met you at Pulse Party, it was kind of like love at first sight. I was like, wow, this guy really gets it. And working with you has been really, really, really nice. And you've introduced me to so many nice people. So thank you for that. And before I really tell you about the practice, remember that
back to the very beginning of the conversation, when we're talking about pregnancy, it's just like the cancer conversation we talked about. The first thing we talk about is like, how are you doing? Right? The experience at the OBGYN clinic is you're sitting half naked on crinkly paper. Somebody comes in, barely introduces themselves. You're laying down. They put your feet in these cold stirrups. They wave a wand into the vagina, and they kind of wave it around like they're driving stick shift, and they're not even looking at you, right? And they're like, oh, there's a heartbeat or there's not a heartbeat or whatever else. And they say, well, let's follow up in a couple of weeks. Congratulations, or, oh, I'm sorry, or whatever. And it's peace out. That's the experience that every woman has in the United States, at least. And I'm sure it's similar in Canada. Well, the ultrasound's important. Yeah. But what about you? Like, what about the person? You're about to go through the most remarkably mystical experience, perhaps, of your life. Let's get to know each other. And that's the first consultation that anybody does with me. I always tell people, do a one-on-one first before you go and buy a package, because you may not like me. I may not like you. And I'm somewhat selective in the people I work with, because the people who are attracted to my practice, which again is Beloved Holistics, it's a private association, which should tell you a little bit of something, right? People who are attracted to my practice are owning their own health. Like, I cannot guarantee you safe passage or your baby's safe passage. I've got a lot of tools to check in on things once in a while, right? We can order studies, we can order labs, we can order medications, we can do all of that stuff. And I will give you my best counseling, back to our conversation around informed consent. But this is your body, and the things that you put into your body, that you do with your body, whether it's moving, sleeping, whatever, that's on you. So we do a lot in my practice. People come to me because they want to get pregnant. They've got chronic pelvic pain that the doctors just want them to be on birth control or get multiple surgeries for. They've got prolapse issues. They've got postmenopausal vulvovaginal atrophy, like everything's dried up and the libido's gone. Like, what can we do naturally for that? I do some bioidentical hormones and things like that. And PCOS, abnormal periods. I mean, it's the full spectrum, but it starts with a conversation between me and you, where we just check in with how you're doing, who you are, who you love. I want to know your dog's name. I want to know your favorite, crayon color. I mean, I want to know everything about you, because not until I understand you can I really provide you with support from person to person. And that's, at the end of the day, I'm still just a man, a husband. I am a doctor, but I'm a father, and I care about people the way that I care for my kids. So my website's belovedholistics.com. I encourage anybody who really wants some truly holistic OBGYN support to go there. I also do palliative care and hospice work remotely, and it's more of the informed decision-making, those hard conversations that we engage in. We do advanced directive conversations, risks, benefits, alternatives to chemotherapy. There's a lot of alternatives to chemo. Chemo kills you, and it oftentimes kills you faster than the cancer. Not always, but the doctor, the oncologist, has a hammer and you look like a nail. So we'll talk about that. And I might even say, you know what? If it was me, I'd get the chemo. Or, if it was me, I'd see Steven Johnson, get some mistletoe therapy, or we'd start vaginal steaming for some early or even precancerous cervical cancer or endometrial cancer, hyperplasia, we call it, right? So there's so many modalities that are not being used in the typical OBGYN practice. And that's why I had to step out of the system in order to try to bring it to the masses. And that's what I do on a daily basis. And I love what I do. So there's a consultation, one-on-one consultation is what I tell people to start with. If you want to work with me, generally, we're going to have to work for multiple sessions. So you save some money if you buy a package of 10 hours. I also send a copy of our friend Paul's book, How to Eat, Move, and Be Healthy, because I think it's nice to have a guidebook and something for you to read when we're not actually working together. And it really is quite comprehensive. I also have a podcast where I'm bringing in voices, people like you. You were on my podcast, and I bring in voices that I think are desperately needed in the women's healthcare space. We've been neglecting women's health for years. We don't study women. We apply, male contrived data to the female population and try to make it make sense, even though we are biologically, hormonally, physiologically quite different. So on the podcast, I bring in, people who are doing some healing in other modalities. I bring in people who do everything from energy work to chiropractics to other medical specialties, to people who have worked hard to develop great supplements. And I had a hyperbaric oxygen therapist on there recently, and man, the utility for that, not just in elite athletes or for horrible infections at the very end of the road when you're desperate for other things. What about routine postpartum healing? Imagine the changes that happen postpartum. We get you into a hyperbaric oxygen chamber for an hour a day for 2 weeks, and bam, you're back. Your hormones are back. Like it's like accelerated adaptogenic treatment, So, without getting into every single modality, that we're exploring, just bear in mind that the Holistic OBGYN podcast is more than just here's what the guidelines say and here's what cervical cancer is. It goes beyond that. That's the easy part. How can we start to address women's health on a truly holistic level, which is body, spirit, soul, the way that I see it. And so that's called the Holistic OBGYN podcast. I have a newsletter I send out every single week, and I tell people about products I'm trying, things that I'm experimenting with, cold immersion therapy, sauna. Analema Water just sent me a device, and it's this fantastic quartz wand that you can structure and make your home drinking water coherent. And yeah, we're just kind of getting the conversation going. We're kind of fresh in the podcast world, but the conversations are rich, and they're not something you're going to find in the typical women's healthcare space, which is quite boring, to be frank.
Absolutely. Well, thank you so much for joining us today. This is a great podcast. We covered everything: birth, death, informed consent, and of course, more importantly, what you can do during getting pregnant and that journey. So I want to thank you for taking the time to join us today. For those who didn't get that, you can check out the show notes. It's www.belovedholistics.com, and the podcast notes are on there with the Holistic OBGYN.
Wait, I forgot to mention one thing that your listeners might be really happy about. I also collaborate with health coaches and other healthcare professionals, midwives, doulas, educators, etc. They pay me a monthly fee, and it's a reasonable fee, and they can exchange with me on anything. We can collaborate on patients. I'll review labs. I'll give my impression of imaging. I also wanted to throw that in there. Sorry for not mentioning it before.
Well, no, that's huge. And I think a lot of people go into they want to have quote unquote a natural birth.
Yeah, right.
But you can, and I've had friends that have done that run into complications because they've discounted really high quality medical information. And again, going back to that risk benefits alternatives, how you can navigate that world. It's not an absolute on either way.
That's right.
And having someone with your capabilities, your understanding, and more importantly, your empathy, I think is someone that you would want on your team with something as sacred as the birth or the death process. So I hope you enjoyed this podcast, everyone. I'm Wade T. Lightheart from Bioptimizers, the Awesome Health Podcast. If you like it, share it. People that might have questions with a medical doctor or people that you'd like to find out more about informed consent, please check out the links below. See Dr. Nathan. I couldn't recommend him more. Thank you so much for joining us today, and we'll see you on the next edition.
Thank you.
And now for a Bioptimizers fixed digestion tip: how to get away with eating sugar. Hey, look, sugar is normally one of the worst things for you. But let's be honest. I mean, we all cheat from time to time. And here's a little trick that will ensure your body benefits from the sugar. Now, before you eat or drink anything sweet, take 5 to 8 capsules of P3OM. The patented strain in the formula devours sugar so fast it literally doubles in the body every 20 minutes in the presence of sugar. That doesn't mean that you can or you should eat a bunch of sugar or sit around all day doing that. But on the days that you do cheat, or you go after one of those maybe meals that you wouldn't normally do, this ensures that you get something in your gut that eats the sugar. And it's not going to feed the bad guys or spike your blood glucose nearly as much. So to learn more about P3OM and its sugar-devouring and protein-digesting properties and how it can transform your gut and metabolism, go to www.bioptimizers.com.
Thank you for listening to the Bioptimizers Awesome Health Podcast. You can find more information at bioptimizers.com.